Welcome to another edition of This is Public Health, a podcast from the Illinois Department of Public Health. On this edition, we're looking at the issue of firearms violence and its emergence as a public health issue and discussing a number of programs and initiatives aimed at keeping everyone safer. We're joined by Shannon Lightner, Chief Operating Officer at IDPH, and by Christian Heyne, Chief Program and Policy Officer for the Brady Campaign to Prevent Gun Violence, one of the nation's leading organizations aimed at reducing and preventing firearms violence. Thank you both so much for joining us. Shannon, I'd like to start with you because this conversation happens against the backdrop of a recent and significant announcement by the U.S. Surgeon General, Dr. Vivek Murthy, who declared that gun violence is a public health crisis. What's the significance of this announcement, and how does it tie in with IDPH's efforts in this area?
So by having the Surgeon General release this report and declaring gun violence a public health crisis, we are coming together as a country to say that gun violence is preventable. It is a public health issue that has strategies that we can implement to take action to prevent more violence from occurring. It's squarely putting the issue in the public health wheelhouse where we have data and we have strategies we can implement, and we can work together with our other stakeholders, our sister agencies, advocacy, universities, et cetera, to make an impact and not just say that there's nothing we can do and throw up our hands. So coming together as a country, making this mark and prioritizing it is huge. We are so thankful that the U.S. Surgeon General took this action.
And as you noted, there are multiple strategies that can then be deployed to address this issue. Before we get into some of those specifics, though, we'd like to welcome Christian Heyne to the discussion. Again, Christian with the Brady Campaign to Prevent Gun Violence. And Christian, I'm sure most of our listeners are familiar with the Brady Campaign, but please give us the history and mission of your organization.
Yeah, absolutely. And first and foremost, thank you so much for having me on here. We're just so incredibly thankful and honored and excited about this work that we're forging ahead with, because we know just how impactful it can be, right? The conversation that we're having here today is not abstract, it's tangible. And we at Brady, we live that every day. We are an organization that is founded, rooted in, and named after survivors of gun violence. Our organization, Brady, bears the namesake of Jim and Sarah Brady. Jim was, fatally wounded in the assassination attempt on Ronald Reagan's life. He was fortunate to live many years after that shooting. He eventually died from those wounds, but him and his wife, Sarah, really created a roadmap for how we can proactively make an impact and difference in this public health crisis. And they worked, with gun owners and non-gun owners alike, Democrats, Republicans. Their mantra really rooted in this idea of how can we take action and not sides to make an impact in gun violence. And so, today's Brady is still an organization like myself, led by survivors of gun violence. I personally was impacted by gun violence in 2005. Brady is the organization where I found my voice as an advocate and as a policy expert. And today, we at Brady are really trying to leverage a three-point strategy that, in essence, is working to change the laws, to change the gun industry, and to change the culture so we can meaningfully address gun violence in all of its forms.
IDPH has been working with the Brady Campaign, the Ad Council, and other entities on an effort called Pause to Heal, which seeks to inform and educate the public on how to obtain and use firearm restraining orders, also known as FROs. Christian, what is an FRO and when is it appropriate to seek one?
Yeah, well, a firearms restraining order is a type of extreme risk law. These are sometimes known as red flag laws and really have been one of the most effective tools, really rooted in epidemiology and evidence, to try to temporarily separate someone who is in crisis, who is at a heightened risk of dangerous behavior, either for, potentially risky behavior for self-harm or for interpersonal violence. How do we just temporarily separate that individual in crisis from firearms so that they can get the help that they need and eventually go on to live a long life without fear of either committing some kind of a horrible tragedy or harming themselves? And what we've seen in practice is these tools have been incredibly effective at preventing firearm suicide and mass shootings in particular. And so these tools are new in the modern age. They are civil orders, so they don't create new avenues of criminality. And it truly is trying to create space and opportunity for people to get the help that they need and to prevent tragedies before they ever occur.
You've already alluded to this, but what do we know about the effectiveness of FROs and what happens when they are obtained versus when they are not?
Well, we do know from a number of studies that have been done that, once again, not only are these policies that are really shown to be effective at preventing firearm suicide, but they also, I just will state, they're policies that are rooted in evidence, right? The kinds of risk that are being evaluated that courts are looking at are behavioral risk factors that are really show us who is at the most heightened risk of dangerous behavior, right? There's no better predictor of future acts of violence, for instance, than past acts of violence. Alcohol, drug misuse, these are all kinds of indications. And oftentimes the people closest to us, our family members, our loved ones, they're the ones who can see that somebody is really at risk of this dangerous behavior, but they oftentimes lack a mechanism to be able to protect them. And what these tools do is they give those family members an opportunity to work with law enforcement, with the courts, to be able to temporarily separate them so they can have that time to heal. And what we've seen in places like Connecticut, for instance, Duke did a study on the risk warrant law that's existed there for some time, is that for every 10 to 20 orders that were issued in that state for a period of time after Virginia Tech, when the tool saw an increased usage, is that for every 10 to 20 orders that were issued, at least one suicide was averted. And what we've seen since the law and policy was passed in California is a number of case studies of individuals who got gun violence restraining orders, is what California calls theirs. When these orders were issued, people who were at this heightened risk of committing a mass shooting, who had plans to execute them, who had firearms that otherwise would have been able to carry them out, that they went on to go get help that they needed and did not commit the kinds of atrocities that they were purporting to do. So these are tools that are showing a real clear efficacy on the back end. But the evidence also informs how these tools have been written, how these policies have been written. And I think that's why it's one of the most exciting things that I get to work on.
You're listening to This is Public Health with the Illinois Department of Public Health. Among our guests is Christian Heyne with the Brady Campaign to prevent gun violence. And Christian, this is all about safety, but how do we balance this quest for safety with the constitutional rights of people to keep and bear arms?
That question right there, Jim, is the question that we're always asking ourselves, right? We want to make sure that we are putting forward solutions that don't prevent someone from utilizing their Second Amendment right. At the same time, how do we make sure that we're doing everything we can to make sure that people can live free from fear of being shot? And I think what this tool does is it was modeled specifically and directly after a host of policies that have been deemed constitutional in all 50 states. The policies that I'm talking about are regarding domestic violence restraining orders. And so these are orders that carry a host of deprivations that are balanced with the risk to public health. And the way that we balance that and provide due process is to make sure that there's really robust security and process for within the court system. So law enforcement is not just issuing these orders and removing the firearms. They have to go to a court. They have to appeal. Family members have to go stand in front of a judge. The judge has to find that there is this imminent risk and have to essentially provide this order and issue this order. And then law enforcement goes and provides the notice and they remove the firearms. And there are access to appeals throughout this multiple phases of this process. The process, by the way, this prohibition of purchase and possession of their firearms, it's temporary. It's intentionally temporary to cover this period of risk. And so at every turn that this order has been created, we've been really intentional about making sure that the respondents of these orders have every opportunity possible to either defend themselves or to make sure that they have the opportunity to appeal after the fact and that the courts are involved from the very beginning. So these orders have been designed to make sure that they are in line with so many other processes that we have to prevent gun violence before it starts.
We'll tell you more in just a moment about how you can find out more information on firearm restraining orders and how they can be obtained when needed. Before we get to that, I want to turn back to Shannon Lightner, Chief Operating Officer at IDPH, to talk about some of the other firearm safety efforts within IDPH. A big one over the past year has been a major gun lot distribution effort. Shannon, tell us how that came about and how successful has it been so far?
Yeah, thank you for asking. So many advocates worked with our state legislature to appropriate funding to the Illinois Department of Public Health for the specific purpose of distributing free gun locks and having a safe storage campaign. And we are so proud to announce that we've distributed over 100,000 free gun locks in just over a year, and we're still moving forward. And these gun locks will help prevent children or those not trained in safe gun usage, or those who might want to harm themselves from accessing quickly guns and keeping those guns safely stored. We've been distributing them at local health departments, community events, the state fair, national night outs, back to school nights, suicide prevention awareness events, all sorts of things throughout the state. And we are also distributing information on how to safely use them, how to use the gun locks and apply them, as well as information on the national 988 lines and our crisis hotlines.
There are other ways that IDPH also works to promote safe storage. Talk about some of those initiatives.
Yeah, so we are very excited that we also were able to put out some grant opportunities to fund community organizations, to fund healthcare providers and other nonprofits on gun lock and safe distribution as well. And they are pairing those distributions with brief counseling or educational sessions, which have been shown to significantly increase safe storage practices. Some of those grants are also being used on safe storage counseling and screening for healthcare providers, because we know that we need to enlist all the help we can get from our healthcare providers who are seeing people in ERs and working with pediatric patients and populations. And then we're also providing grants on education and training on the Firearm Restraining Order Act so that people understand what this means and how to use it. So we are very excited to have this opportunity and the funding to do these grants.
All part of this comprehensive effort to address gun violence as a public health crisis. Shannon, where can people go to learn more about Pause to Heal, about some of these other efforts to promote firearm safety?
So if you Google Pause to Heal in Illinois, it should be the first thing that pops up, and you can find more information there.
And Christian Heyne with the Brady Campaign, if people would like to learn more about your organization, where do they go?
If you go to bradyunited.org, you can see so much of the work that we do, including work around these orders themselves. But I just will reiterate, please go online, Google Pause to Heal. This effort that we have in partnership with IDPH, it's going to change lives. It's going to save lives. And I'm just going to take one moment to say, look, at the essence and core of this campaign, we're trying to provide hope really for people who otherwise are feeling hopeless. Oftentimes when a loved one is in crisis, we feel like there's nothing we can do. And that is overwhelming. That's an overwhelming feeling. And what this tool does is it gives families the ability to proactively protect their loved ones. And what we see is when they do that, individuals are given time to be able to find help that they otherwise have never accessed before. So I'm so excited. Brady is so excited for this partnership, for the work we're doing with Ad Council, with IDPH, to be able to bring this into individuals' living rooms and provide hope to individuals and families that may be feeling hopeless. And I think together, a lot of lives are going to be saved. So please Google Pause to Heal, go to the website on IDPH, check out the information, the resources, and let's get this tool out there.
Christian Heyne, Chief Program and Policy Officer for the Brady Campaign to Prevent Gun Violence. Shannon Lightner, Chief Operating Officer at the Illinois Department of Public Health. Thank you both for joining us here. Join us next time for another edition of This is Public Health with the Illinois Department of Public Health.